one of the things I discovered early on is that the data suggested that dietary changes rapidly can improve cardiovascular risk factors, even within 21 days.
I've seen it.
Gary, you know this.
Yeah, we've seen it on thousands and thousands of patients. Yeah.
So I usually go with these particular patients who have these metabolic abnormalities. I go with primarily a low carb Mediterranean style diet. So I say go cold turkey, not forever, but go completely cold turkey on the starch and the sugar for the next 6 weeks, right? And usually they come back
white flour, white bread, pasta,
absolutely bread,
potatoes.
pasta, rice, potatoes,
grains.
Too much fruit juice, for example, all these sorts of things. And then and that's really all they need to do. But of course, I do give other advice as well around, the exercise. I say, keep it simple. A lot of people who are very overweight and starting from a very sort of, it's not necessarily good for them to go really hard in the gym at that stage, right? They want to just get into a better, but keep it simple. Can you do a 30-minute brisk walk every day, for example? Just, get a little bit out of breath, 30 minutes a day, doesn't cost anything. And then one of the missing parts of this discussion, which again, as I think had a profound impact on my thinking in the last few years, is the impact of stress and the impact of stress reduction. Again, for when it comes to heart disease, you're absolutely right. It's a similar risk to being a smoker, having type 2 diabetes, or having high blood pressure. But most of us are not dealing with it, we don't know how to deal with it. And the mechanism behind it, there's a really interesting paper published in The Lancet, I think it was 2020, where they took hundreds of people in middle age and they used a high-tech MRI of the brain called fMRI to look at the amygdala in the brain, which is the emotional center. And what they correlated was the subjective levels of stress. There was more activity in the amygdala with people who were stressed.
So they reported, I am stressed out.
Absolutely. And that also correlated perfectly with inflammatory markers in the blood and clotting factors. When we know heart disease,
inflammatory and clotting.
Yeah. So the evolution of the understanding of heart disease is got very little to do with LDL cholesterol. I mean, we need to keep calling this out. It's nonsense.
Yeah.
It's a chronic inflammatory process, which is related to clotting and insulin resistance. So that's probably the likely mechanism of how chronic stress causes heart disease. The good news is we do have some data, and it makes sense that if you engage in activities to reduce your stress, and that's what I always tell my patients to do.
Right.
And actually, I send them to there's a brilliant nurse I work with who is a stress reduction expert, but an expert particularly in breath work. That is likely going to have an effect on the heart, but also improve quality of life, mental health. And when they are going through dietary change,